The scapular region. Borders of the region. The superior border is a line drawn from the acromioclavicular joint perpendicular to the spine. It ends with the spinous process of the seventh cervical vertebra. The inferior border is a line running through the inferior angle of the scapula. The medial border runs along the inner edge of the scapula until it intersects with the superior and inferior borders. The lateral border runs from the lateral end of the acromion vertically down to the inferior border. This is a line that runs along the posterior edge of the deltoid muscle in the posterior axillary line. As you can see, the scapular region has only 4 borders. We begin layer by layer analysis of the area. The skin of the scapular region is thick with limited mobility, sometimes covered with hair and has many sebaceous glands. Subcutaneous fat is dense, single-layered, and cellular due to connective tissue partitions extending from the skin in depth to its own fascia. Penetrated by numerous fibrous strands, subcutaneous fat contains many small lymphatic vessels. The posterior rami of spinal nerves pass through the subcutaneous fat. They innervate the skin in the back area. The superficial fascia of the scapular region is dense, fixed by fibrous strands to the skin and fascia propria. It can be represented by several sheets of varying density. There are practically no suprafacial formations. The thin subcutaneous nerves are branches of the axillary and supraclavicular nerves.
The fascia propria is thin and undeveloped. Below it are located muscle trapezius and muscle latissimus dorsi, constituting the superficial muscle layer. The superficial branch of artery encircling the scapula is divided into transverse and descending cutaneous branches. The terminal and cutaneous branches form a fairly dense network of anastomosis, consisting of both subdermal and epifascial plexuses.
The scapular spine divides the region into 2 fossa, supraspinatus and infraspinatus. The superficial muscles do not cover the entire scapula. The outer part of the infraspinatus fossa remains free of them. Under trapezius muscle and latissimus dorsi muscles, there are dense aponeurotic sheets of sub- and supraspinatus fascia, which together with the posterior surface of the scapula form bone, fibrous beds filled with deep layers, muscles, and small amount of fiber. The supraspinatus bed there is musculus supraspinatus, in the infraspinatus, musculus infraspinatus. Musculus teres minor begins from the outer edge of the scapula and from its lower corner, musculus teres major. Superficial muscle layer. Musculus trapezius, beginning, the external occipital protrusion and the superior nuchal line of the occipital bone, the nuchal ligament, the spinous process of the 7th cervical and all thoracic vertebrae, the supraspinous ligament. Attachment, acromial end of the clavicle, acromium, spine of the scapula, innervation, ramus extremus nerve, accessory and cervicalis nerve, blood supply, transverse colli occipitalis and suprascapularis intercostal arteries. Musculus latissimus dorsi, beginning, the spinous process of the 6th lower thoracic and all lumbar vertebrae, the dorsal surface of the sacrum, the outer lip of the iliac crest, ribs from 9th to 12th. Attachment, crest of the lesser tubercle of the humerus, innervation, thoracodorsalis nerve, blood supply, thoracodorsalis circumflex humeri, intercostal arteries. The deep muscle layer, musculus supraspinatus, beginning, supraspinatus fossa of the scapula, supraspinatus fascia. Attachment, greater tubercle of the humerus, capsule of the shoulder joint, innervation, suprascapularis nerve, blood supply, suprascapularis and circumflex scapular arteries. Musculus infraspinatus, beginning, infraspinatus fossa, infraspinatus fascia, insertion, greater tubercle of the humerus, innervation, suprascapularis nerve, blood supply, circumflex scapula, and suprascapularis artery. Musculus teres minor, beginning, lateral edge of the scapula, infraspinatus fascia, insertion, greater tubercle of the humerus, innervation, axillary nerve, blood supply, circumflex scapular artery. Musculus teres major, beginning, lower angle of the scapula, infraspinatus fascia, attachment, crest of the lesser tubercle of the humerus, innervation, subscapularis nerve, blood supply, subscapularis artery. Musculus subscapularis, beginning, costal surface of the scapula, attachment, lesser tubercle of the humerus, innervation, subscapularis nerve, blood supply, subscapularis artery.
Then there are 2 neurovascular bundles in the scapular region. The first consists of artery and vein suprascapularis, branches of thyrocervical trunk from the subclavian artery, and nerve suprascapularis from the brachial plexus, innervating the supraspinatus and infraspinatus muscles. The vessels and the nerve pass through the scapular notch into the supraspinatus fossa, are located at first under the supraspinatus muscles and then going around the free edges of scapular spine, penetrate into the infraspinatus bed. Here the suprascapular artery form numerous anastomosis with a branch of circumflex scapular artery from the subscapular artery. The suprascapular vein accompanies the artery of the same name in the form of two trunks that connect and form one trunk following into the terminal section of external jugular vein or into the subclavian vein.
And the second neurovascular bundle consists of the descending branch of transverse artery of the neck, ramus descendens artery transverse coli, from the subclavian artery, veins of the same name and the dorsal nerve of the scapula, nerve dorsalis scapulae, from the brachial plexus, which run along the internal vertebral edge of the shoulder blade. The artery take part in the formation of the scapular arterial circle, located directly on the bone in infraspinatus fossa. The anastomosis of these arteries forms the scapular arterial circle and play an important role in the development of collateral circulation during delegation of axillary artery.
The cellular spaces of the scapular region communicate with cellular spaces of neighboring areas, which determines the path of spread of purulent process. In the upper part of scapular region, the cellular space between muscle trapezius communicates with that of lateral omotrapezoid triangle. Near the neck of the scapula, the supraspinatus and axillary fascia become significantly thinner, and here the fiber communicates with fiber of subdeltoid space. Along the vasa circumflexa scapulae, the fiber of infraspinatus bed communicates with the fiber of axillary region. Inflammatory process can also enter this region through the triangular space that is formed by round muscle and the head of long triceps.